High blood pressure is one of the most common chronic health conditions affecting adults over the age of 60. Often called the silent killer, hypertension usually develops without obvious symptoms, yet it significantly increases the risk of heart attack, stroke, heart failure, kidney disease, vision loss, and other serious medical problems if left untreated. Fortunately, modern medicine has provided several highly effective medications that help control blood pressure and reduce these risks. One of the most widely prescribed medications is amlodipine, a drug that has been used safely by millions of people around the world for many years. Despite its long track record, many seniors have questions about how it works, when to take it, what side effects to watch for, and whether it is the right medication for them. Today we will talk about seniors. Watch this before you take amlodipine. So, before we start, make sure to hit the like button and subscribe to my channel. What is amlodipine? Amlodipine belongs to a group of medications known as calcium channel blockers. These medications help relax and widen blood vessels. When blood vessels become more relaxed, blood flows more easily. As a result, blood pressure decreases, the heart does not have to work as hard, and blood flow to the heart muscle may improve. Because of these effects, amlodipine is commonly prescribed for high blood pressure, certain types of chest pain called angina, and some other cardiovascular conditions determined by a healthcare provider. It has been used successfully for decades and remains one of the most commonly prescribed blood pressure medications worldwide. Why controlling blood pressure matters? Many people feel perfectly healthy despite having high blood pressure. Unfortunately, hypertension often causes silent damage over many years. Without treatment, it increases the risk of heart attack, stroke, heart failure, kidney disease, vision problems, peripheral artery disease, and cognitive decline. Lowering blood pressure significantly reduces these risks. This is why healthcare providers emphasize long-term treatment even when no symptoms are present. How amlodipine works: calcium plays an important role in muscle contraction. Blood vessel walls contain smooth muscle. Amlodipine limits the movement of calcium into these muscle cells. This allows blood vessels to relax. The widened arteries reduce resistance to blood flow. Consequently, blood pressure decreases, the heart pumps against less resistance, and oxygen delivery to the heart muscle may improve. Unlike some blood pressure medications, amlodipine generally has little effect on heart rate. When should you take amlodipine? Many people wonder whether morning or evening is better. For most patients, the most important factor is taking amlodipine consistently at the same time every day. Some healthcare providers recommend morning dosing. Others prefer evening dosing. The best timing depends on your blood pressure pattern, other medications, side effects, and daily routine. Follow your healthcare provider's instructions rather than changing the schedule on your own. Common side effects. Most people tolerate amlodipine very well. However, some side effects may occur. The most common include swelling around the ankles or feet, mild dizziness, headache, flushing, and fatigue. These side effects are often mild and may improve as your body adjusts. If swelling becomes significant or bothersome, speak with your healthcare provider rather than stopping the medication yourself. Why ankle swelling happens? Ankle swelling is one of the best-known side effects of amlodipine. This occurs because the medication widens certain blood vessels, allowing fluid to collect more easily in the lower legs. Although this swelling is usually not dangerous, it should still be discussed with your healthcare provider. Sometimes adjusting the dose, changing medications, or adding another blood pressure medication may reduce the swelling. Never assume ankle swelling is always caused by medication, because heart failure and other conditions can also cause swelling. Can amlodipine cause dizziness? Yes, this happens especially when treatment first begins or the dose increases. Lower blood pressure may temporarily reduce blood flow to the brain when standing quickly. Doctors recommend standing slowly, sitting on the edge of the bed before standing, staying hydrated if medically appropriate, and using handrails when necessary. Persistent dizziness deserves medical evaluation. Important medication interactions. Amlodipine may interact with certain medications. Examples include some antibiotics, certain antifungal medications, specific cholesterol medications, other blood pressure medicines, and some heart medications. Always inform your healthcare provider about prescription medications, over-the-counter medicines, vitamins, and herbal supplements. This helps reduce the risk of unwanted interactions. Lifestyle habits that improve blood pressure. Medication works best when combined with healthy daily habits. Doctors recommend reducing sodium intake, eating more fruits and vegetables, choosing whole grains, maintaining a healthy weight, walking regularly, strength training when appropriate, avoiding smoking, limiting alcohol, managing stress, and sleeping 7 to 9 hours each night. Healthy habits often improve blood pressure while benefiting overall health. Should you check blood pressure at home? Many cardiologists encourage home monitoring. Home readings provide valuable information about daily blood pressure patterns, medication effectiveness, white coat hypertension, and treatment adjustments. Measure blood pressure at the same time each day, after resting quietly using a properly fitting cuff. Record the readings and share them during medical appointments. Foods that support healthy blood pressure. A heart-healthy eating pattern includes leafy green vegetables, beans, lentils, whole grains, fish, berries, nuts, seeds, low-fat dairy, and olive oil. These foods provide nutrients that support healthy blood vessels and cardiovascular function. Limiting highly processed foods and excessive sodium is equally important. Can you stop taking amlodipine once blood pressure improves? This is one of the most common misconceptions. Normal blood pressure usually means the medication is working. Stopping treatment without medical supervision may allow blood pressure to rise again. Never stop taking amlodipine simply because you feel well. Discuss any medication changes with your healthcare provider first. Warning signs that require immediate medical attention. Seek emergency medical care if you experience chest pain, difficulty breathing, swelling of the face, lips, tongue, or throat, severe dizziness with fainting, very low blood pressure, or signs of stroke. Although serious reactions are uncommon, prompt treatment is important. Common myths about amlodipine. Several myths circulate online. One myth claims amlodipine permanently damages the heart. Current scientific evidence does not support this. Another suggests everyone experiences severe swelling. Most patients experience little or no swelling. Some believe natural supplements completely replace prescription medication. While healthy lifestyle changes are extremely valuable, they should never replace prescribed treatment without medical guidance. Questions to ask your cardiologist. During your next appointment, consider asking whether amlodipine is the best medication for you, what blood pressure goal you should aim for, whether you should monitor blood pressure at home, how you can reduce ankle swelling, and if your other medications could interact with amlodipine. Personalized advice helps optimize treatment. The importance of regular follow-up. Blood pressure management is an ongoing process. Regular appointments allow your healthcare provider to review blood pressure readings, monitor side effects, adjust medications when needed, evaluate kidney function if appropriate, and assess overall cardiovascular risk. Consistent follow-up helps ensure long-term treatment remains safe and effective. If you liked this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.